one health crisis. Dr. C. Everett Koop gives straightforward answers to your most important questions in an information special, AIDS, everything you and your family need to know but were afraid to ask. Next.
Hello, I'm Dr. C. Everett Koop, your Surgeon General. AIDS is a contagious, fatal disease for which there is currently no vaccine, no cure. By the end of 1991, it is estimated that as many as 270,000 Americans will have AIDS, and more than 170,000 will have died of it. We are at war, and the epidemic continues to grow. This is a greatly magnified view of the AIDS virus. 1,350,000 Americans are infected with AIDS and don't know it. Those who disregard the nature of AIDS and how it is spread endanger not only their own lives, but the lives of others. The battle demands our immediate attention as individuals and families. In the beginning, many Americans had little sympathy for the homosexuals and the intravenous drug abusers who made up the majority of the AIDS victims, feeling that somehow they deserved their illness. We know better now. We are fighting a disease which can attack any of us. I realize that many have remained fearful and confused by half-truths, by rumors, and myths about AIDS. This program will help clear the air by answering questions about the disease, questions gathered from people like you and your neighbors from across the country. AIDS can and must be stopped. Our first line of defense is accurate information which may very well save your life.
Where did this disease come from?
Is there any such thing as safe sex anymore?
Why do some people get AIDS and others do not?
Like, how many people are gonna die?
And I don't know how much of what I'm reading is true.
They have said that it's in the saliva.
Why should I get an AIDS test more than anyone else?
God forbid one of my boys gets AIDS. What do I do?
When are we going to get the answers to these questions? We'd kind of like to know.
I'd like to ask the Surgeon General a question. This morning, I was in the subway and this gentleman coughed right into my face. I know that the common cold is caught that way. How about AIDS?
You do not get AIDS by non-sexual, casual contact. And if someone with AIDS were to sneeze on you, you might get influenza or cold or all sorts of other things, but you would never get AIDS.
Can you contract AIDS from saliva from one mouth to another mouth?
You don't find AIDS in saliva. You find the virus of AIDS in practically every fluid in the body, but it is only in sufficient quantity be transmitted to another person in semen or in blood.
Is there any way to prevent getting AIDS from these blood, hypodermic needles, drug addicts, bites?
Policemen never have to worry about tears or sweat or vomit or stool or urine. I doubt that they come in contact with semen very often. But if there were an opportunity, and this is a remote possibility, where you were in contact with large quantities of blood from an AIDS patient and the policeman himself had open cuts on his hand or was shot in the same robbery, then there is a possibility, but still it's quite improbable.
Can you get AIDS from a mosquito bite?
I also wanted to know if it's possible to contract the disease through mosquitoes. My doctor has also informed me that this is possible too.
You cannot get AIDS from a mosquito. And let's be very clear about what mosquitoes are. They're very specific about what they do in reference to disease. The Culex mosquito transmits yellow fever, and the Anopheles mosquito transmits malaria. You can, under any circumstances, get them to switch roles. The Culex will not do malaria, and the Anopheles will not do yellow fever. And we have not only evidence in the laboratory that the virus is not passed that way, but we have a lot of clinical studies. There is one place in this country, Belglade, Florida, where everybody said, see, there's a community with lots of mosquitoes, and it must be due to mosquitoes. But it's strange that in that community, no non-sexually active older people and no children who were equally bitten by mosquitoes ever got AIDS.
Can you get AIDS through kissing?
You know, me and my friends, you know, I'm getting older, so, you know, we want to go out with the boys and everything. And, you know, from kissing, can we get AIDS?
I wanted to know if you could get AIDS through intimate kissing.
I have gone on record saying that deep kissing, French kissing, wet kissing, whatever you call it, is something that people should not be afraid of. I always add the caveat that there is the remote, very remote possibility that someone could, on some occasion, get AIDS that way, but it certainly is not probable.
If somebody is sweating and you rub up against them and you absorb their sweat into your body fully, could you get AIDS?
An athlete could not transmit AIDS to another athlete by sharing his sweatshirt, by borrowing his towel, by using his razor, by using his deodorant. No.
If I were to use a public telephone on the street, should I be worried about getting AIDS that way?
You couldn't get AIDS from that telephone if one person spit in it and the other person went and licked it up. That's not the way AIDS is transmitted.
In a public toilet, if somebody sits down on a toilet seat and has an oozing cut on their backside, can the person that goes into that toilet after, within a few hours, contract the virus if they too have an open sore on their backside?
There's absolutely no way that a healthy person could catch AIDS from a toilet seat, regardless of who sat on it before or the state of his health.
If AIDS-contaminated blood is spilled on the floor or on equipment, how long can that AIDS virus live on the surface in the air?
Can you catch the AIDS virus through the air?
No, this is a very fragile virus, and that's fortunate. If this were a tough virus, we'd have lots more difficulty than we have now. But this virus is very fragile, and it does not survive outside of the body, outside of blood and semen very well to be transmitted, and it certainly is not something that would be airborne.
Since I'm getting married this year, and a couple people have asked me, are you going to get an AIDS test? Why should I get an AIDS test more than anyone else?
Well, if a person is entering marriage, we've already talked about that, it makes good sense to know what the other one's blood test is. Not just because if one is positive and one is negative, the chances of the other getting it is very high, but also if that union is going to bring about a child, we have entered another whole new problem, because pregnant women who carry the AIDS virus pass it on to their offspring in about 1/3 of the cases, and those children die. The other 2/3 are born having a positive test for the AIDS antibody. But most of them, in the course of the next 18 months, lose that positivity and go on to be thriving children. That is what we call passive immunity. And a pregnant woman will pass on immunity to her newborn child, not only in relationship to AIDS, but to other diseases such as measles or mumps or whooping cough and so on.
So I'd like to know, how exactly is the AIDS test performed?
It's very easy to have a test taken on one's blood to determine whether or not he is carrying the AIDS virus. And it's possible to carry the AIDS virus and to be perfectly well and have no symptoms whatsoever in reference to AIDS. The way it is usually done is to have a screening test, which is called the ELISA test, and if it's positive, it's repeated. And if that's positive, then one goes to a definitive test called the Western blot test, so that when someone is diagnosed as being HIV positive, it means he's had 3 blood tests, and they all corroborate each other.
Dr. Coop, I'm a sexually active person. Should I get tested?
Dr. Coop, shouldn't everyone get tested for AIDS?
I don't think that every sexually active person should have this test done. A couple that has been living together, married in faithful monogamy for the last 10 years, I think they're wasting their time and their money. On the other hand, people who practice high-risk behavior, and I've been through that, homosexuals, bisexuals, IV drug abusers, those who have multiple sexual partners, or who think at any time that they have come in contact sexually with somebody who is carrying the virus, I think should want to be tested. There is a great reluctance on the part of some people who think they're positive to be tested because they don't want to know. Because in a sense it is a death warrant and they'd rather not be certain. And my advice to anybody who feels that he or she might be positive and has not been tested, treat your sexual partners as though you were already known to be positive. It's the only ethical thing that you can do.
Could I get AIDS through a public swimming pool?
My question is, I swim a lot, and I want to know if it's possible for me to contract the AIDS virus.
There's no way that an AIDS patient could pass his disease to another by being in a swimming pool with them or sharing the same water in a hot tub.
Is there any way I can get AIDS if I use a public shower?
I suppose you could have a chance of 1 in 100,000 of 2 people with bleeding feet walking around the same shower. You might transmit it, but I doubt it. Certainly would not be of any concern to me.
With me being in high school, do I have to worry about the utensils or plates I use in the cafeteria?
Could the disease be transmitted from a chef in the kitchen who has maybe an open sore cooking the food and then is served to you?
Well, I suspect that if the cook did cut his finger, the blood wouldn't get into the food the person was going to eat. But I would have absolutely no fear of eating in a restaurant where the cook and all the waiters had AIDS, because you just don't get it by passage of the virus in this non-sexual, casual way. Remember that even if this virus were to be ingested in food, your stomach juices would destroy it. You just don't get it by that.
I was wondering about manicures, whether or not the bleeding on your fingers would pose a danger if you don't have sterilized instruments in between manicures, if it could be contracted that way.
I would not be afraid of going to have a manicure. I've never had a manicure, but I wouldn't be afraid to have that done, because I don't think AIDS is transmitted that way.
I want to get my ears pierced, but I'm afraid of putting a needle through my ear.
If a person wanted his ears pierced, or her ears pierced, I would have it done by someone who would have sterilized equipment. Equipment is sterilized in the medical profession by heat as a rule, and not by just soaking it for a few minutes in a solution. But let's get right to that point too. This virus of AIDS is so fragile that even exposure for a very short period of time to ordinary household bleach will kill it.
As a healthcare worker, I'm concerned now about the evidence that's coming in about us working in general with AIDS patients. I would really like to know how you feel about that. How much at risk are we?
About 1,200 health workers were studied before and after they spent time taking care of patients with AIDS. The time of exposure to the AIDS patients was in excess of a year. And during that entire time, 450 of those health workers acknowledged that they had done something in the way of breaking technique that they thought might have given them AIDS. And yet at the end of the time of the study, only 2 people had become seropositive. And both of those were nurses who remembered having withdrawn a needle from the vein of an AIDS patient and immediately sticking themselves with it. And we already know that blood to blood is the best way to catch AIDS.
I've been reading about the 3 healthcare workers who have AIDS. What about them?
First of all, one of those health workers had a disease known as sarcoidosis, which already depresses the immune system. So you can't count that worker as being a normal person. Secondly, the individual who held a finger on a bleeding blood vessel for a long period of time had severely chapped hands, and there were open cuts. And finally, the health worker that was splashed with the blood in her face actually pushed blood into a closed vessel, which exploded. And so it wasn't just that she was splashed, the blood was delivered with jet propulsive force. And I think, again, that's not a usual situation.
After reading in the paper about a dentist contacting AIDS, I'm kind of concerned. I want to know if I should stop going to the dentist.
There is the remote possibility that the dentist, if he had cuts on his finger and had a lot of close contact with the bleeding gums of a dental patient, that he might get it. But again, it's very unlikely.
Should you insist these days that your dentist wear gloves?
If you see your dentist wearing gloves, it doesn't mean he has AIDS or he thinks that you have AIDS. Rather, he is more concerned about hepatitis. Hepatitis is 40 times more dangerous to a dentist than is AIDS. But I think dentists should wear gloves just to protect themselves from all patients.
Well, I'm kind of concerned about blood transfusion. How safe is it?
Blood transfusions in the United States of America today are the safest any place in the world. And I don't think people should be concerned about taking blood, and there's never been any danger in donating blood. Before we knew about AIDS, there were people giving blood who had the virus, and therefore there were people who received blood and transfusion who also received the virus. By 1985, we had a test to screen blood for transfusion, and since 1985, the blood supply has been essentially safe.
I'm not in the third grade. I'm not an adolescent. I'm 48 years old, and I've had a pretty active sex life that I do not want to discontinue. I simply want to do it safely, and I want all the information I can get.
Is a woman more at risk of getting AIDS from a man, or would you say a man is more at risk of getting AIDS from a woman?
The virus has gotten into the heterosexual population, and at the present time, of all the people who have AIDS, 4% of them received it by ordinary heterosexual relationships. And it is easier for a woman to get AIDS from a man because of the high concentration of the virus in the semen, but it is possible for a man to get AIDS from a woman because there are collections of the virus in the cervical secretions of a woman. But it is not as easy female to male as it is male to female.
I've been living with the same person for about 7 years now, but I'm wondering if any of my ancient history might creep up on me.
When you have sex with another person, you're having sex with all the people that person had sex with previously. Now, knowing that the incubation period of AIDS can be as long as 9 years, maybe much longer, we don't know yet, we haven't been around that long. But it could be certainly as long as 5 years. So I think that one has to take into account the sexual behavior of an intended partner for about the previous 5 years.
I was wondering if condoms help prevent the spread of AIDS.
Most people who use a condom for birth control use it after they have had sexual foreplay, after they have had genital contact, many times after they've had sexual intercourse, and the condom is put on before the male ejaculates. You do that in reference to AIDS, you've exposed yourself to all the things you shouldn't expose yourself to. So that for AIDS or any other sexually transmitted disease, before there is even genital contact, there should be a condom on the penis. Now, as far as finish is concerned, this advice goes for both contraception and for AIDS or any other sexually transmitted disease. After the man has had his climax, the penis slowly loses its erection. And unless the male disengages himself, before that happens, there is a chance that the condom can come off, and in which case the woman would be exposed either to pregnancy under certain circumstances or certainly to any organism of a sexually transmitted disease.
Dr. Cooper, certain condoms better than others?
When I say condom, I'm always thinking about a latex condom. And because of the number of condoms that come into this country now in bulk and are repackaged here under brand names you've never heard of before, I also say be sure that you use an American condom of a well-recognized brand.
Are condoms really safe?
Are condoms 100% safe?
The figure usually given in this country is that condoms have a 10% failure rate. But let me explain how wrong that could be. Let's say that a surveyor approaches a couple and says, "What method of birth control do you use?" "Well, we use condoms." "Have you ever had a failure?" "Yes, as a matter of fact, we have a child we didn't expect." So that gets checked off as a failure for condoms. However, if you go back and talk to that couple and say, "Tell me exactly how you use your condoms." "Well, you see, we really practice rhythm except when my wife thinks she's fertile." Well, that is not a failure of condoms. That is, again, human unreliability. So one has to be very careful about using statistics that are taken from surveys. There are two very good studies that were done in the United Kingdom with intelligent people intelligently and properly taught about condoms. And the failure rate in those two studies was 2% in one and 3% in the other. It is my feeling that if you properly taught people how to use condoms, that they could expect a very decent success rate in reference to sexually transmitted diseases. almost all condom failures in reference to birth control, if you examine them carefully and quiz people about them, has nothing to do with the condom. It has to do with the people.
Is there anything to do to make the condom more safe?
It would seem, on the basis of preliminary studies, that some spermicides used in conjunction with a condom increase the effectiveness of the condom. We are doing a very large study now on condoms and and spermicides, and we ought to have that material probably by the end of the year.
Is oral sex safe?
To be 100% absolutely on the safe side, you would have to say it is possible, remotely possible, to transmit AIDS by oral genital contact, mouth to penis, mouth to vagina. Certainly if it's mouth to anus, you've got lots of other problems besides AIDS to think about. But I have to say that it is, again, unlikely.
Would I be more at risk contracting AIDS having sex during my period?
That's a very good question, and no one has ever asked me that before, and I think the answer is yes. If indeed it is semen and blood that we're concerned about, it makes sense that if a woman is menstruating, or if she is receiving into her vagina semen shortly after she stopped menstruating, probably has a higher incidence of picking up the disease than she would in the latter half of her menstrual cycle.
Is there any way to be 100% safe?
The only absolutely 100% guaranteed way to avoid AIDS is to be sexually abstinent. Now, AIDS or no AIDS, I think that's good advice for youngsters in school. It probably is not a very viable way of life for most adults. Fortunately, if one cannot be abstinent, he can seek a mutually faithful monogamous relationship, which means that you have one continuing sexual partner and that he or she is as faithful to you as you are to him or her. However, there always will be people who are not abstinent, who have not, for whatever reason, found a mutually faithful monogamous relationship, and who will continue to have sex with multiple partners. To those people, we have to say, you're taking chances, and the only thing we have to offer people like that is the use of a condom.
Can a person have AIDS and not know it? How long is the incubation period of the AIDS virus?
AIDS has a long incubation period. From the time that you're invaded by the virus until you come down with the disease, we know can be as long as 9 years. Now, that being the case, it's very difficult to say that you never will come down with this disease. And some researchers believe that if you are seropositive, if you live long enough, you will indeed have the manifestations of full-blown AIDS and will probably die of it.
If I have the AIDS test and I'm tested positive, will I always be contagious?
You are always contagious. Once you have received this virus into your body, you are contagious even though you don't know you've done it and even though you have absolutely no symptoms to indicate it.
As a mother of young children, I'm a bit concerned about the prospect of my children contracting AIDS through drooling on playground facilities or in daycare centers. Is that a possibility?
Can babies and or children contract AIDS from one another? If a child has AIDS in a playgroup type setting and has a cut, say, can the other babies contract AIDS from that baby?
I would not be afraid to have my child go to a school where there were other children who had frank AIDS. And certainly I would not be the least bit afraid to have them go to school with children who were seropositive and were carrying the virus but did not have any manifestations of the disease. Again, you cannot pass this disease by non-sexual casual contact. There's a study that was done on families where one or more members had hemophilia and had received transfusions or clotting factors and were subsequently known to be infected with the AIDS virus. These families were studied very closely, and it was found that in spite of the fact that they shared beds, that they shared towels, that they shared cooking utensils, that they even shared toothbrushes, there was not one single case of non-sexual transmission of this disease. That's important to remember.
I just recently returned from Australia,
And there was a case over there of a young child who was going to nursery school who had AIDS. The child was also a biter, and a lot of the parents in the school were concerned about their child being bitten by a child with AIDS. Was this a reasonable concern of the parents of the other children?
The question of biting always comes up. There is the virus in saliva, but as I've already said, it is not in high enough concentration to be passed. And I don't think that even a child who is bitten has a chance of getting AIDS from a child who has it. So I would not be concerned.
I am a first grade teacher and my students are between 5, 6, 7 years old. With the sex education problems that we already deal with, what age would it be good to begin an instruction in AIDS, and just what should I tell these children?
I don't think you have to tell a 7-year-old child what AIDS is. I think you should be spending your time more properly in telling him who he is, to have some respect for his body, to have some respect for the bodies of other people. And then when he gets a little bit older, like 9, 10, 11, depending not so much on how old he is, but what his developmental age is, then you talk to him about the transmission of disease, of which AIDS is one. This is not terribly complicated. You know, when a little kid cuts his finger, his mother says, "You better put a Band-Aid on that or you'll get an infection." Well, right away, you've introduced that child to the fact that out there someplace, there are things that can get in here that are not good. He gets a little older and he sneezes on his grandmother, and his mother says, "Don't do that. You'll give grandma your cold." So he now knows, I've got something in me that I can give to my grandmother that isn't good. Well, if you start that way, when he gets to the age of 9 to 11, you can say, we've talked to you about these sexual relationships that people have. That's another way you can get diseases. There are many of them. One of them is AIDS. AIDS doesn't have a cure. Therefore, avoid those things that give you AIDS.
We've only seen this AIDS problem for the last 8 years or so. How does a virus like AIDS develop?
Where did this disease come from?
I'm not sure we'll ever know. I don't think it's important to know. Much more important to spend our time and our effort on finding a way to get out of the mess we're in. I would say that the consensus, most people at the moment, is that AIDS probably started in African monkeys and made its way into the human population through blood. Usual scenario would be, in as much as monkeys are used there for food, that a hunter killing a monkey and skinning it, cut himself and got it, passed it on, as we know it can be done now.
Why are some people, like homosexuals, considered to be a high-risk group when it comes to AIDS?
Who are the high-risk groups? Well, let's get rid of that word high-risk group, because it's a misnomer. All kinds of people engage in high-risk behavior. And so let's talk about the behavior. And those that we consider to be practicing high-risk behavior are homosexual men, bisexual men, IV drug abusers, and heterosexual people who have multiple partners or who have sex habits which would get them in contact with other people who have high-risk behavior.
I have a lot of gay friends, and I was wondering, why does it seem to be attacking homosexual men more than anybody else?
Well, remember that the AIDS virus is found in highest concentration in blood and in semen. Anal intercourse practiced by homosexuals produces both blood and semen, so it's easy to see how the virus is passed readily.
Why are prostitutes a high-risk group?
Prostitutes in big cities very frequently are prostitutes in order to pay for their drug habit. And they may not be necessarily infected because of sexual contact, but they're infected because they have shared needles with a drug addict who already has AIDS. So if you're worried about AIDS, steer clear of prostitutes, both male and female.
Dr. Coop, I'd like to know how drug addicts give AIDS to one another.
Drug addicts are at risk in reference to AIDS only if they are intravenous drug abusers. And the reason for that is that there is a cultishness about intravenous drug abuse where they enjoy sharing not only needles but syringes and other paraphernalia, and they rather enjoy mixing the blood of one person with another because it does something to the cultishness that goes with this problem. But if there is just a tiny drop of blood in the syringe that has come out of one person's vein and that person has AIDS, and then it is used to inject drug into another individual. It's a marvelous way for the virus to go from blood to blood, and that's why they get it. As a matter of fact, of the heroin addicts in New York City, about 90% already test positive for AIDS.
If you live in a big city, are you more at risk than living in a small town?
We do have the greater proportion of AIDS cases in large metropolitan areas. There are now about 25 cities in America that have had more than 300 cases, and as time goes on, you're going to find that this disease is spread pretty evenly around the country. So I don't think one should be the least bit concerned about going to a big city in reference to AIDS unless he plans to have some kind of sexual behavior there or to shoot drugs.
How does one recognize someone that has the disease? Do they have marks on them? Do they look funny?
I've heard so much about the symptoms of AIDS that I'd like to know what they really are. Will I get headaches? Will I have spots on my body? Will I be coughing? Is it painful?
The first symptoms may simply be after 2 or 3 weeks or 6 or 8 weeks, a simple flu syndrome, just a viral syndrome with fever, headache, diarrhea. The virus often then goes latent, goes underground, goes silent. It enters the DNA and the chromosomes of certain cells, particularly white cells or brain cells. After months or years, an infected person may develop illnesses related to AIDS, but milder, called AIDS-related complex, or ARC. If AIDS itself eventually develops, the first sign may be a tumor on the skin or inside the body. These tumors are called Kaposi's sarcoma. Another common sign of AIDS is pneumocystis pneumonia, an unusual kind of pneumonia that may have a very rapid course and can lead to death if not recognized and treated early. Studies have shown that about 1/3 of people who have been infected with the AIDS virus will develop AIDS within 5 to 7 years after their infection. Another third may develop ARC, and perhaps as many as a third will have no clear manifestations of the AIDS virus infection. Whether that third that has escaped any clear AIDS illness for up to 5 to 7 years will go on to develop AIDS over time, we don't know yet. We'll have to wait and see.
What does the current research say about the possible cure for AIDS?
Dr. Koop, why is it so difficult to find a cure for AIDS?
It's difficult because this is a very complicated virus, and it's part of a group of viruses called a retrovirus. And when it enters the bloodstream of a patient, it goes immediately to unite with the DNA in specific cells. Now, once it's done that, you cannot get it away from those cells. So that some people say that a cure is next to impossible. But that does not mean that we couldn't have a drug that would keep the virus from replicating itself in a person. And that, of course, would be a tremendous boon.
There's a lot of publicity about AIDS nowadays, and I'm just wondering if the government is withholding information from the public about how bad the problem of AIDS is.
This government is telling you every single thing that we know about AIDS, and sometimes we're telling you things perhaps too much and too soon. And I would caution you that there are out there books, pamphlets, newsletters scaring people to death about the fact that the government is covering up something. Why would we possibly cover up the greatest threat to our health that's ever existed since we've been a nation? We need the cooperation of the American people. We don't want to hoodwink them in any way.
Having traveled extensively in West Africa and having seen what the epidemic of AIDS has done there, could that same epidemic happen here?
The important thing to know is that Africa, with very little homosexuality, with very little drug abuse, has a tremendous problem with AIDS, with populations of some countries that have as much as 11% of their people carrying the virus. And this is why the World Health Organization looks to the early years of the next century and says that as many as 100 million people could have died, and that's true. I'd like to make one thing clear about where AIDS stands in our country as a health hazard. I'm known because of my very strong stand against smoking, and I have said over and over again that smoking is the #1 public health problem in America. From the point of view of the number of people who die, it still is. But it is not the greatest threat 10 years down the road, because AIDS is that threat.
I wonder if you think that it might not be a warning and a scourge to our nation for being disobedient to the laws of God, that perhaps we've fallen away into too much promiscuous sex, the young people of this world.
If someone wants to think that this is a judgment from God, that doesn't mean that that person has to also assume the role of judge. And what I've been trying to convince the American people about is that even if AIDS seemed to have its beginning in a class of people that you do not feel comfortable with or that you might condemn for their type of behavior, we are now fighting a disease and not people. We must not ignore these people. We must not reject them. They are part of the human family. AIDS is a 100% fatal disease for which there is no cure and for which there is no vaccine in sight. The only way that AIDS can be prevented by an individual is for him to understand how the disease is transmitted and to do those things about his own behavior which will protect him from exposure to the virus. That means don't shoot drugs. It means do not have sex with people that you do not know and whose state you cannot attest to. And if those few things are followed, this epidemic could be contained in no time.
I'm Dr. Robert Wyndham, the Assistant Secretary for Health of the United States. We hope that we have given you all of the information you need to fully understand AIDS, both to protect yourself and your family and to avoid needless panic. We need to deal in facts. I know this program has taught you a great deal about AIDS, but you may want to know more. We suggest the following sources of information. You can write AIDS, HBO, American Red Cross, National Headquarters, Washington, D.C., 20006. You can call the Public Health Service National AIDS Hotline, 1-800-342-AIDS. In addition, you can call 1-800-992-CURE for the free brochure, Facts About AIDS, from the American Foundation for AIDS Research. I'm Dr. Robert Wyndham, the Assistant Secretary for Health of the United States. Thank you.
If you would like a transcript of this program, send $3 to Journal Graphics, HBO AIDS Transcript, 2 John Street, New York, New York 10038, or call 1-800-USA-TEXT.